Okay, so in this video, we're going to be testing for patient's motor system. First of all, I'm just going to, as I have my patient sitting here, I'm just going to assess for any form of asymmetry in the posture and patient's balance. I'm going to check for any involuntary movements such as tics and tremors, the arms and the legs. I'll also just in response to position and movement. And also check for the arm and the thigh muscles, even the muscles in the hands. I'm gonna check for, I'll be checking for atrophy or hypertrophy. I'll also check for patient's resistance to force, and then also grade the strengths accordingly, like from 0 to 5. Okay. So first of all, we're going to check for the muscle bulk. And checking for muscle bulk is just, assessing and looking to see and notice if there's any atrophy or hypertrophy. Most of the time, it's usually measured like the biceps muscles or the triceps. Usually the muscles are usually measured with a tape to see if there's any differences on both sides. And usually the assessments is usually done on both sides. So for tone, usually in like a patient, like my patient's lying down, I'm just gonna gently shake, just to relax the muscles, and then I'm just gonna flex it, just lift it up and flex. So if the most muscle is slightly increased, you see the heel would just slide down, just probably skitter off the bed. And if it's moderately increased, it will just lower in an arc. It will lower in an arc form. And if there's a further increase, it takes takes time to further lower into the bed, and sometimes with a clonus, which is usually noticed. So usually you lift up, you rub the thighs gently just to relax the muscles, and just quickly do a tug just to lift it up, and then you see the way it reacts. And usually if it's normal, it just slides on the bed normally. Okay. Secondly, we're gonna do check for strength. Okay, so sometimes you can ask the patients to put their arms out straight, right, and then just supporting your supporting the shoulder. You can actually try to apply pressure on the arm and see if they're able to resist. Even at times you ask them to do an extension, and then you push against their arm and to see if they're able to resist, and then probably pull down. Ask them to flex their arms out, and then you're trying to pull down. If they're able to resist that force applied, they actually have a normal strength. But if they're not, that shows weakness in your arm. You can also do it for the when sitting. You can ask them to push up. Just push up the thigh while seated. And then you try to apply pressure. If they're able to resist that force on both sides, then it actually the patient actually has strength in those areas. Even you could also have the patient to grab two of your fingers, hold it tight and pull. Sometimes you can also check for that. We don't encourage using 3 fingers, but 2 fingers to be able to pull out. Okay. And then we can also check for coordination. Is the ability of the patient to be able to perform like repeated movements, such as you can ask the patient to put palms on his thighs and be flipping and flip back and forth, back and forth, back and forth, and back and forth like that. Or you can have the patient repeatedly stamp their feet like for about maybe 10 or 15 seconds. Okay, you can also try having the patient do the nose to finger point, where the patient would have to from nose, and then tries to points to my finger, and I keep adjusting to different positions, and the patient keep from nose to hand, and I keep adjusting just to to see if the patient is able to carry out coordination. And then gaits is just, having a patient get up from a seated position and you just walk across the room for maybe a couple of meters, and you also take turns and back. You can also have the patient, walk on their heel to toe, just to see how well they move. You can also ask them to walk on their heels just to check for dorsiflexion to check the dorsiflexion check for dorsiflexion, or have them walk on their toes to check for plantar flexion, just to see if there's any form of weakness in any of those places. And then for stance, in case of stance, it's just having the patient have both hands on the side and having them stand with one of their legs up, having their legs like up in the air, and having one of the legs up like at 90 degrees, and just having them stand for at least 30 seconds. You can try on both legs just to check and see for any form of instability or lack of stance in this situation. So usually it actually checks for patients posture and balance. So that's what the stance test is. Okay. So we're gonna check do assessment on the sensory system. Okay, so we're gonna be checking for temperature and pain. Okay, so I'm just gonna assume this is a toothpick. So it's because it's the toothpick is pretty blunt, and it's not really advisable to use something really hard, really sharp. So because some patients sensitivity to pain could be very intense. So just something blunt. So I'm just gonna check around the patient's legs and just move down, and I'm just gonna try to compare on both sides. So it's gonna be like a pin, using it's a pin prick test. I'm just gonna check to see how patients respond to pain on both sides. If patient's able to feel pain on both sides equally, then it's within normal limits. But if there's a difference, there's that numbness and feeling maybe one aspect of the limbs, then maybe we have some issue going on. And I'm also for temperature test, I'm probably gonna use a turning fork or something really cold, just to touch on different sides of the patient's maybe limbs, just to compare if the patient is able to feel cold, if there's any temperature changes. Some patients have neuropathy and they can really feel pain, or they can't really feel temperature changes. So this is a very good test. Maybe just use a cold metal or a cold turning fork, and then just try different aspect and try the arm too, just to see if patient is able to differentiate or feel whatever has been applied, cold temperature, or if something is really hot. Okay, and also checking for vibration. We could use a turning fork, and then we're just gonna cause it to vibrate, and usually it's actually tested on the joint of the toe, of the first toe. You can apply the vibration. You can apply the vibration to the joint of the great toe, and just see if the patient is able to feel the vibration. You compare it probably to both sides. You can also apply the vibration, and then have your hand and just feel it at the back to see if you can feel that vibration right at the back, okay, of the great toe as well. So just compare both sides. And then for light touch, so we can just use a tip of a brush and then just brush on patients on the lateral shin, maybe at just close to the ankle here, under the feet, just to see if patient is able to feel if there's any difference in touch, and the patient can tell you how exactly they're feeling. They're able to feel or have any sense of touch at all. So that kind of helps, differentiate the sense of touch on both sides. And then discrimination, this is just maybe having a patient's eyes closed. You can even try like different objects. You can put an object in the patient's hand and ask them to feel what it is. Try it on both sides, or you can use the pin prick method, where you can prick the patient. You prick the patient was able to tell you if it's one prick or two, like if it's like two pins or just one pin prick. Yeah, you try it on both sides just to be able to differentiate, to see if patient's able to differentiate pain, or be able to differentiate like objects in their, just to feel for objects in their, feel for, just feel for objects in general, feel for objects and feel and have like some feeling for pain or something like that. Okay.